Welcome to another Autism Daily Talk. Is eye contact really that important in early childhood development? I think let's start by just having a look at what does making eye contact mean. So we've got to ask questions like, does my child make eye contact when I call his or her name? Does the child look at me? Does my child make eye contact when they're requesting attention? Pulling at you, looking at you, asking for something. Does the child look at you during a conversation, like I'm looking at you through the screen right now? Does the child engage in eye contact during group activities with a family or with friends or with strangers? So in many instances, particularly when the child is very young, ages 2 and 3, many parents are going to answer no to some of these. So let's have a look at what are some of the reasons why children struggle to make eye contact. So firstly, when a child struggles to make eye contact, it could be a sign of an underlying anxiety, also known as a social anxiety. Not making eye contact could be brought on by a fear of the actual person that they need to be looking at. In very young children, it could be an indication of a hearing problem. Maybe they're not reacting appropriately from a hearing perspective. So they're not hearing you when, they're calling your name, or if something drops, they're not necessarily following that and responding to that noise by looking at the noise. It could be that the child is struggling to focus, or that he or she would rather look at the floor or away, which is, signs of an attention problem. Visual processing difficulties that impedes fixation of the eyes. So, that's something that we need to consider. We need to consider that maybe the child isn't making eye contact because of auditory processing difficulties, which can lead to a child rather looking, at maybe your mouth or your chest or your arm or something along those lines. We could look at sensory processing difficulties, which is very much when the child is looking into another person's eyes. It becomes so overwhelming for the child that it's uncomfortable. In a normal developing child, a lack of eye contact can mean that they're trying to hide their emotions. It could mean they're embarrassed. It could mean that they're scared. It could mean that they, kind of telling a lie. There's cultures, where that people don't make eye contact because of cultural aspects, and where eye contact is seen as a sign of disrespect. It could also just be, that social motivation to make eye contact doesn't exist. And I think that, ultimately we need to look at when a person isn't making eye contact, for whatever the reason is, the person isn't making eye contact. You know, what is the cause of it? We need to find out, because some of them, could be detrimental to the child's learning, where others, may not. If it's a cultural thing, then no, it wouldn't, be detrimental to the person's, learning and educational future. Avoiding eye contact can be part of a subjective list of red flags. And, there's a whole lot of diagnoses that could go hand in hand with a child having difficulties with making eye contact. So there is always a reason for a child not making eye contact. And it is very important for mom and dad to get to the bottom of what that reason is. It's going to give you so much insight into the child's developmental difficulty, and or, just understanding the child better. And in order to help the child overcome some of these challenges, we're going to, need to address certain behaviors. But we physically cannot, address a behavior if if we don't know where it's coming from. So yes, eye contact in young children is important. It's important to know whether your child is or is not making eye contact. It's not always that important for the child to make eye contact. And I know that sounds really contradictory, but there are reasons why children are not going to make eye contact. I mean, my daughter, can learn beautifully without making eye contact. And for her, eye contact is very sensory. Now that she's 14 years old, she'll be 15 later on this year. There are times where she makes the most incredible and intense eye contact, which is something that, if I think back of, Maddie never did from the day she was born. So I think the lack of eye contact is definitely a red flag that parents need to address. And it doesn't necessarily mean that the child has autism spectrum disorder. Eye contact or a lack of eye contact doesn't equal autism. It's not a diagnostic criteria of autism. It does get taken into consideration during the diagnostic process, but it definitely isn't. If the child doesn't look at me, then the child has an autism spectrum disorder. So our recommendation is going to be, if your child isn't making adequate eye contact from as young as 12 months, 18 months, start going to those developmental pediatricians and get it assessed to see what the underlying difficulties may or may not be. I hope that this has answered your question today, and look forward to another session with you soon. Take care of you. Have a good day. Stay safe.